twin brothers Lincoln and Taj Bradley are just 5 years old, but they've already got a pretty good idea of their favourite foods.
Carrots, apples, bananas, everything.
But while these two can't get enough of their fruit and veggies, many kids their age don't have such nutritious diets, and their health is already suffering.
By the time children are 5 years of age, approximately 1/4 of children are either overweight or obese, and 1/3 of children have had tooth decay.
For the past few years, nutrition expert Dr. Lucinda Bell has overseen a major South Australian study, analysing the link between early eating habits and poor childhood health.
All mothers and their babies born in metropolitan hospitals here in Adelaide in 2013 to 2014 were approached to be involved in the study. And those mothers that consented to be involved completed a questionnaire there and then when their baby was a newborn, and then also again when their child was 3, 6, 12 and 24 months of age, and then again at 5 years of age.
Lincoln Taj's mum Claire was one of 2,000 mothers who participated in the study. As if raising her 4 kids wasn't enough of a handful, for each questionnaire, Claire had to note down every single thing she was feeding her family.
Everything, what sort of meat, what sort of fruit, if they have lollies, ice cream, yogurt, just went forever. Very comprehensive.
So in this data set, we have the dietary data from the 12-month time point when children were 1 year of age approximately. And we've got by row each food item that they consumed. So this particular participant had some toddler milk, bread, margarine, banana, biscuits, pumpkin, sweet potato, yogurt, pear, cheese and chicken nugget and potato for the day. So in this particular study, we found that most 1-year-olds were eating fruit. However, only half were eating orange and green vegetables over the 3-day period, which we know are really key to a healthy diet. We also found that about 1/3 of the 1-year-olds were eating sugary products such as sugary cakes and biscuits, flavoured yogurts and also processed meat. And we know that this is quite important because they either contain sugar or are high in energy or calories, and these are both key contributing factors to tooth decay and weight gain.
The frequency of toothbrushings.
As part of the study, each child also received regular dental examinations. The results were analysed by oral epidemiologist Lok Gyang Do, who found a clear link between kids' diets and a type of tooth decay called early childhood caries.
We have reported that children who had high level of sugar intakes had almost 2 times higher the risk of having early childhood caries at the age of 2 years. In Australia, ECC is a major factor for children being admitted to hospital for treatment under general anesthetics. So ECC is clearly a public health problem that we need to address.
What our children eat doesn't just impact their short-term health. Research shows that we form most of our food preferences within the first few years of life. So Dr. Bell says it's crucial that parents pay closer attention to what they feed their kids.
What we'd like to see is perhaps some of those key messages around offering a healthy diet to children often and exposing them to healthy foods as often as possible to help increase children's desire to like and taste healthy food. We know that it can be really difficult to get children to eat healthy food, but just to remember that it's a marathon and not a sprint.